Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Edoxaban antithrombotic therapy for atrial fibrillation and stable coronary artery disease. Background. Despite consistent recommendations from clinical guidelines, data from randomized trials on a long-term antithrombotic treatment strategy for patients with atrial fibrillation and stable coronary artery disease are still lacking. Assigned 524 patients to the Edoxaban monotherapy group, and 516 patients to the dual antithrombotic therapy group at 18 sites in South Korea. The mean age of the patients was 72.1 years. 22.9% were women, and the mean CHA2DS2 VASC score was 4.3. At 12 months, a primary outcome event had occurred in 34 patients, Kaplan-Meier estimate, 6.8%, assigned to Edoxaban monotherapy, and in 79 patients, 16.2%, assigned to dual antithrombotic therapy, hazard ratio, 0.44, 95% confidence interval, c. 0.30 to 0.65, p. less than 0.001. The cumulative incidence of major ischemic events at 12 months appeared to be similar in the trial groups. Major bleeding or clinically relevant non-major bleeding occurred in 23 patients. Kaplan-Meier estimate, 4.7%, in the Edoxaban monotherapy group and in 70 patients. 14.2%, in the dual antithrombotic therapy group. Hazard ratio, 0.34, 95% C, 0.22 to 0.53. Conclusions. In patients with atrial fibrillation and stable coronary artery disease, Edoxaban monotherapy led to a lower risk of a composite of death from any cause, myocardial infarction, stroke, systemic embolism, unplanned urgent revascularization, or major bleeding or clinically relevant non-major bleeding at 12 months than dual antithrombotic therapy. Inflammation, cholesterol, lipoprotein A, and 30-year cardiovascular outcomes in women. Background. High-sensitivity C-reactive protein, CRP, low-density lipoprotein, LDL, cholesterol, and lipoprotein, A levels contribute to 5-year and 10-year predictions of cardiovascular risk and represent distinct pathways for pharmacologic intervention. More information about the usefulness of these biomarkers for predicting cardiovascular risk over longer periods of time in women is needed because early life intervention represents an important risk reduction method. Conclusions. A single combined measure of high-sensitivity CRP, LDL cholesterol, and lipoprotein A levels among initially healthy U.S. women was predictive of incident cardiovascular events during a 30-year period. These data support efforts to extend strategies for the primary prevention of atherosclerotic events beyond traditional 10-year estimates of risk. Xalnesiran with or without an immunomodulator in chronic hepatitis B. Background. Xalnesiran, a small interfering RNA molecule that targets a conserved region of the hepatitis B virus, HBV, genome and silences multiple HBV transcripts, may have efficacy, with or without an immunomodulator, in patients with chronic HBV infection. TONS conclusions. Among participants with chronic HBV infection who had virologic suppression with NA therapy, treatment with Xalnesiran plus an immunomodulator resulted in HBsAg loss at 24 weeks after the end of treatment in a substantial percentage of participants. Trastuzumab Deruxtecan after endocrine therapy in metastatic breast cancer. Background. Outcomes in patients with hormone receptor-positive metastatic breast cancer worsen after one or more lines of endocrine-based therapy. Trastuzumab Deruxtecan has shown efficacy in patients with metastatic breast cancer with low expression of human epidermal growth factor receptor 2, HER2, after previous chemotherapy. Conclusions. Among patients with hormone receptor-positive, HER2-low or HER2 ultra-low metastatic breast cancer who had received one or more lines of endocrine-based therapy, treatment with Trastuzumab Deruxtecan resulted in longer progression-free survival than chemotherapy. No new safety signals were identified. Prenatal cfDNA sequencing and incidental detection of maternal cancer. Background. Cell-free DNA, cfDNA, sequence analysis to screen for fetal aneuploidy can incidentally detect maternal cancer. Additional data are needed to identify DNA sequencing patterns and other biomarkers that can identify pregnant persons who are most likely to have cancer, and to determine the best approach for follow-up. Conclusions. In this study, 48.6% of participants who received unusual or non-reportable clinical cfDNA sequencing results had an occult cancer. Further study of DNA sequencing patterns that are suggestive of occult cancer during prenatal screening is warranted. Next, we will be discussing articles from Journal of American Medical Association. HepB-CpG versus HepB-Alum Vaccine. In people with HIV and prior vaccine non-response question, does vaccination with a hepatitis B vaccine with a cytosine phosphoguanine adjuvant, HepB-CpG vaccine, improve hepatitis B virus, HBV, seroprotection in people with HIV and non-response to prior hepatitis B vaccine? Findings in this open-label, randomized clinical trial that included 561 people with HIV. 93% achieved HBV seroprotection with 2 doses of HepB-CpG vaccine, and 99% achieve HBV seroprotection with 3 doses of HepB-CpG vaccine versus 81% with 3 doses of conventional hepatitis B vaccine with an aluminum hydroxide adjuvant, meaning a superior response was achieved in people with HIV and non-response to prior hepatitis B vaccination, who received 2 or 3 doses of HepB-CpG vaccine. Message reminders to improve adherence to chronic cardiovascular medications. Question. Can test message reminders improve medication adherence and clinical outcomes among patients non-adherent to cardiovascular medications? Finding in a pragmatic randomized trial of 9,501 patients at 3 U.S. healthcare systems, the 3 text messaging medication refill reminder strategies tested, generic reminders, behavioral nudge reminders, and behavioral nudge reminders plus a fixed message chatbot, did not increase refill adherence at 12 months or reduce clinical events, meaning additional interventions need to be rigorously tested to try to improve adherence to chronic cardiovascular medications given the growing incidence of cardiovascular conditions. Next, we will be discussing articles from Annals of Internal Medicine. A framework for considering the value of race and ethnicity in estimating disease risk. Background. Accounting for race and ethnicity in estimating disease risk may improve the accuracy of predictions, but may also encourage a racialized view of medicine. Objective. To present a decision analytic framework for considering the potential benefits of race-aware over race-unaware risk predictions, using cardiovascular disease, breast cancer, and lung cancer as case studies. The race-unaware predictions were substantially miscalibrated across racial and ethnic groups, compared with the race-aware predictions as the benchmark. However, the clinical net benefit at the population level of race-aware predictions over race-unaware predictions was smaller than expected. This result stems from 2 empirical patterns. First, across all 3 diseases, 95% or more of individuals would receive the same decision regardless of whether race and ethnicity are included in risk models. Second, for those who receive different decisions, the net benefit of screening or treatment is relatively small because these patients have disease risks close to the decision threshold, that is, the theoretical point of indifference. Conclusion. The analysis highlights the importance of foregrounding changes in decisions and utility, when evaluating the potential benefit of using race and ethnicity to estimate disease risk. Next, we will be discussing articles from British Medical Journal. Chocolate intake and risk of type 2 diabetes, prospective cohort studies. Objective 2: prospectively investigate the associations between dark milk and total chocolate consumption and risk of type 2 diabetes, T2D, in 3 U.S. cohorts. Results. In the primary analyses for total chocolate, 18,862 people with incident T2D were identified during 4,829 175 person-years of follow-up. After adjusting for personal, lifestyle, and dietary risk factors, participants consuming greater than or equal to 5 servings/week of any chocolate showed a significant 10%, 95% C2% to 17%. P-trend equals 0.07, lower rate of T2D compared with those who never or rarely consumed chocolate. In analyses by chocolate subtypes, 4,771 people with incident T2D were identified. Participants who consumed greater than or equal to 5 servings/week of dark chocolate showed a significant 21%, 5% to 34%. P-trend equals 0.006, lower risk of T2D. No significant associations were found for milk chocolate intake. Spline regression showed a linear dose-response association between dark chocolate intake and risk of T2D. P for linearity equals 0.003, with a significant risk reduction of 3%, 1% to 5%, observed for each serving/week of dark chocolate consumption. Intake of milk, but not dark chocolate, was positively associated with weight gain. Conclusions: increased consumption of dark, but not milk, chocolate was associated with lower risk of T2D. Increased consumption of milk, but not dark chocolate was associated with long-term weight gain. Further randomized controlled trials are needed to replicate these findings and further explore the mechanisms. Next, we will be discussing articles from Lancet. Balloon guide catheters for endovascular thrombectomy in patients with acute ischemic stroke due to large vessel occlusion in China. Protect Mount, a multi-center, open-label, blinded endpoint, randomized controlled trial. Background. The effectiveness of using a balloon guide catheter during endovascular thrombectomy in patients with acute ischemic stroke due to large vessel occlusion of the anterior circulation remains uncertain. We aimed to assess the effectiveness and safety of using a balloon guide catheter during endovascular thrombectomy, compared with using a conventional guide catheter, in this patient population. Interpretation. Compared with conventional guide catheters, the use of balloon guide catheters led to worse functional recovery in patients receiving endovascular thrombectomy for intracranial large vessel occlusion. Future studies are needed to confirm these results. Next, we will be discussing articles in the field of hemato-oncology. Here are the articles from Journal of Clinical Oncology. Phase 3 Keynote 789 Study of pemetrexed and platinum with or without pembrolizumab for tyrosine kinase inhibitor-resistant, EGFR mutant, metastatic non-squamous non-small cell lung cancer. Purpose: epidermal growth factor receptor, EGFR, tyrosine kinase inhibitors, TKIs, are standard first-line therapy for EGFR mutant, metastatic non-small cell lung cancer, NSCLC. However, most patients experience disease progression. We report results from the randomized, double-blind, Phase 3 Keynote 789 study of pemetrexed and platinum-based chemotherapy with or without pembrolizumab for TKI-resistant, EGFR mutant, metastatic non-squamous NSCLC. Conclusion: addition of pembrolizumab to chemotherapy in patients with TKI-resistant, EGFR mutant, metastatic non-squamous NSCLC did not significantly prolong PFS or OS versus placebo plus chemotherapy in Keynote 789. Here are the articles from Journal of Hepatology differing genetic variants associated with liver fat and their contrasting relationships with cardiovascular diseases and cancer. Genetic analysis of UK Biobank MRI data revealed 13 variants associated with liver fat. Key mechanisms for liver fat accumulation include lipid retention and enhanced de novo lipogenesis. Impaired triglyceride export lowers cardiovascular risk, while enhanced de novo lipogenesis increases it. Higher liver fat is causally linked to non-alcoholic cirrhosis, liver cancers, and type 2 diabetes, regardless of the underlying mechanism. Findings indicate the need for personalized treatment and risk assessment based on liver fat accumulation mechanisms. Next, we will be discussing articles in the field of gastroenterology. Here are the articles from Gastroenterology. Atlas of Metastatic Gastric Cancer links ferroptosis to disease progression and immunotherapy response. Background and context. Metastatic gastric adenocarcinoma significantly contributes to high patient morbidity and mortality, necessitating a comprehensive understanding of the cellular and molecular cues, as well as the metastatic dynamics, to develop effective therapies. New findings. Liver and peritoneal metastases demonstrate distinct cancer cell and tumor microenvironment properties, with tumor cells evading ferroptosis by upregulating GPX4 during gastric adenocarcinoma progression. Inhibiting ferroptosis resistance reduces tumor growth and metastasis, while resensitizing ferroptosis enhances chimeric antigen receptor T-cell therapy efficacy. Here are the articles from Journal of Clinical Rheumatology. Anticoagulant treatment may decrease the relapse rate of pulmonary arterial involvement in Behçet's disease. Objectives. Pulmonary arterial involvement, PAI, is one of the most common causes of mortality in Behçet's disease, BD. In this study, we aimed to evaluate the clinical features, course, and recurrence risk factors of BD-associated PAI conclusions. Pulmonary arterial thrombosis is the main presentation type of PAI in BD, whereas aneurysmatic formation is rare. Despite immunosuppressive treatment, relapses occur during follow-up in 1/3 of patients with PAI. When anticoagulant therapy is added to immunosuppressive therapy, the relapse rate in BD patients with PAI is significantly reduced. Next, we will be discussing articles in the field of cardiology. Here are the articles from Circulation. Restricted versus liberal transfusion in patients with type 1 or type 2 myocardial infarction, a pre-specified analysis of the MINT trial. Background. The MINT trial, myocardial ischemia and transfusion, raised concern for harm from a restrictive versus liberal transfusion strategy in patients with acute myocardial infarction, MI, and anemia. Type 1 and Type 2 MI are distinct pathophysiologic entities that may respond differently to blood transfusion. This analysis sought to determine whether the effects of transfusion varied among patients with a Type 1 or a Type 2 MI and anemia. The authors hypothesized that the liberal transfusion strategy would be of greater benefit in Type 2 than in Type 1 MI. Side conclusions. The concern for harm with a restrictive transfusion strategy in patients with acute MI and anemia raised in the MINT primary outcome manuscript may be more apparent in patients with Type 1 than Type 2 MI. Here are the articles from Journals of the American College of Cardiology. Major bleeding and mortality after revascularization of left main disease. Background. The incidence and prognostic impact of major bleeding, MB, after percutaneous coronary intervention, PCI, and coronary artery bypass grafting, CABG, for left main coronary artery disease, LMCAD, are unknown. Objectives. The goal of this study was to investigate the rates and outcomes of MB after LMCAD revascularization. Conclusions. In the EXCEL trial, CAB resulted in higher 5-year rates of all MB and in-hospital MB, although post-discharge MB was more frequent after PCI. MB after both procedures was associated with increased cardiovascular and non-cardiovascular mortality within 5 years. Next, we will be discussing articles in the field of endocrinology. Here are the articles from Diabetes Care. Clinical prediction models combining routine clinical measures have high accuracy in identifying youth-onset type 2 diabetes defined by maintained endogenous insulin secretion, the search for diabetes in youth study. Objective. With high prevalence of obesity and overlapping features between diabetes subtypes, accurately classifying youth-onset diabetes can be challenging. We aimed to develop prediction models that, using characteristics available at diabetes diagnosis, can identify youth who will retain endogenous insulin secretion at levels consistent with type 2 diabetes, T2D, conclusions. Prediction models combining routine clinical measures at diabetes diagnosis, with or without islet autoantibodies or T1-DGRS, can accurately identify youth with diabetes who maintain endogenous insulin secretion in the range associated with T2D. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. Severity of airflow obstruction based on FEV1/FVC versus FEV1% predicted in the general U.S. population. Scientific knowledge on the subject. According to the Global Initiative for Obstructive Lung Disease, GOLD, the FEV1/FVC ratio is used to confirm airflow obstruction in chronic obstructive pulmonary disease diagnosis, whereas FEV1% predicted normal value, FEV1% pred, is used for severity grading. The staging of airflow obstruction by the FEV1/FVC ratio, STAR, was recently shown to discriminate mortality similarly compared with GOLD, but with a more uniform gradation of severity in a selected cohort of smokers and ex-smokers. What this study adds to the field. In this study of the general adult U.S. population, FEV1/FVC and FEV1% pred, as measures of severity of airflow limitation, showed similar prediction of breathlessness and all-cause mortality, regardless of ethnicity and/or race, indicating that both low FEV1/FVC and low FEV1% pred are important predictors of symptoms as well as mortality. Although the two classification systems were correlated, STAR Stage 1 was more clearly differentiated from non-obstruction compared with GOLD Stage 1 in terms of both breathlessness and mortality. This was related to a substantial proportion of GOLD Stage 2 subjects who were reclassified as STAR Stage 1. Next, we will be discussing articles in the field of nephrology. Here are the articles from Kidney International Reports. Prognosis for type 1 diabetes with diabetic nephropathy between 2000 and 2020. Changes in kidney function decline over time and development of cardiovascular disease, kidney failure, and mortality. Introduction. Individuals with type 1 diabetes, T1D, and diabetic nephropathy, DN, experience progressive kidney function decline and high risk of cardiovascular disease, CVD, and mortality. This study explored changes in kidney function decline in new-onset DN between 2000 and 2020, and provided an updated prognosis for risk of kidney failure, CVD, and mortality DA results. The cohort comprised 591 individuals with median, interquartile range, IQR, age at DN onset of 53, 39 to 66 years and 57% were male. In 283 participants, MGFR were available. Plots of eGFR trajectories illustrated tendencies toward higher eGFR in more recent years. However, this was not confirmed in MGFR trajectories. Poor risk factor control, prior CVD, and male sex impacted mortality and morbidity rates negatively. For men and women with fair risk factor control and no prior CVD, the 10-year mortality rate from onset of DN was 28% and 26%, respectively. For men and women with poor risk factor control and CVD prior to DN onset, the 10-year mortality rate was 62% for each sex conclusion. The results do not support an improved prognosis for T1D and DN, emphasizing the urgent need for new therapeutic approaches. Evaluation of race-neutral glomerular filtration rate estimating equations in an Indian population. Introduction. Glomerular filtration rate, GFR, estimation equations have not been extensively validated in the Indian population. Preliminary data showed that the widely used creatinine-based chronic kidney disease epidemiology collaboration, CKD Epicur, 2009 significantly overestimated GFR in Indians. Newer estimated GFR, eGFR, equations based on creatinine and cystatin C, omitting the race, have been recently proposed. We investigated the performance of race-free eGFR equations in the Indian population. Results. A total of 412 subjects, 55% with CKD, average age 47 plus or minus 11 years with an equal distribution of males and females were enrolled. The mean mGFR in the study population was 54.2 plus or minus 30.2 milliliters per minute per 1.73 square meters. The average mGFR in the potential kidney donors subgroup was 79.5 plus or minus 23.2 milliliters per minute per 1.73 square meters. Bias was highest for creatinine-based eGFR equations, CKD EP-ICAR 2021, minus 19.2, minus 21.3 to minus 17.0 ml per minute per 1.73 m2 and CKD EP-ICAR 2009, minus 17.0, minus 19.1 to minus 15.0 ml per minute per 1.73 square meters. Cystatin C, either alone or with other markers, based equations were slightly better, but still did not reach p30 greater than or equal to 80% conclusions. Race-neutral CKD Epicur 2021 equation did not significantly improve performance as compared to CKD Epicur 2009 equation. These observations emphasize the need for developing new eGFR equations for Indians, and to standardize the mGFR for easy access to care providers for individualized patient care.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.